Hi everybody, I am That Nursing Prof and welcome to my channel. In today's video, we're going to be doing another sample care plan. And in this situation, our patient has dementia. So let's get into it. So our assessment data, what do we know? We know their medical diagnosis is dementia. JK is an 87-year-old patient who lives at home. Level of consciousness is alert and orientated ×2, so to person and place. The neuro checks, so we were unable to assess neuro because they were unable to cooperate with us, which sometimes happens. Respiratory assessment, so lungs are clear throughout, breathing is unlabored. Cardiac, regular rate and rhythm, and then +2 pedal pulses. Our GI assessment, active bowel sounds in all 4 quadrants. Our GU, they are incontinent of bladder. Musculoskeletal, overall weakness, and then our vitals are all good. So blood pressure 130/82, heart rate 82, respir 16, O2 of 98%, and temperature of 98.6 degrees Fahrenheit. And then our general survey, the patient appears well groomed and there is a caregiver at the bedside. Okay, so now let's jump into some nursing diagnosis for this patient. The first one, chronic confusion, goes really well with dementia, right? So chronic confusion related to their neurological dysfunction, aka their dementia, right? And this is evidenced by their impaired memory. So what would our goal be? This is not something we can cure, right? We can't give a pill and fix it, right? So what are we going to do? What's a goal for this patient? A realistic goal is the patient will be able to participate in their ADLs, activities of daily living, at the maximum functional ability by the end of the week. So we want them to be able to participate in like getting dressed in the morning, brushing their teeth, kind of like the basic stuff. See if they can help. So how are we going to make that happen? We're going to determine their normal routines and then attempt to maintain them. So getting them into a nice scheduled routine, that's going to help them every day remember what to do. And our rationale for choosing this intervention is activities that are designed to be consistent with past routines were effective at providing engagement and interest and enhancing the quality of life. And then of course we've cited that. So now to evaluate this patient, we can say, yes, it was successful, our goal was met. The patient actively participated in their ADLs by the end of the week. Now you'll notice I'm not saying they're going to do everything by themselves, right? That by the end of the week they're going to be independent, brushing their teeth, getting themselves ready in the morning, that kind of thing. I didn't say that, did I? Right? That was not our goal. Our goal was that they participated in those activities and they were able to do that, so that's a good thing. Our second one is not going to be focused so much on the patient, but on their caregiver, okay? So our second one is risk for caregiver role strain related to the amount of caregiving tasks as evidenced by the caregiver states feeling overwhelmed. And this happens a lot when you're dealing with a patient who is coming from the home setting and they have like home health, or maybe it's like their wife or their kids, somebody in their family is taking care of them. Oftentimes, they will come with them to the appointments and you will see how stressed they are. Don't ignore them, okay? Don't only focus on the patient. Ask them, how's it going? Do you have any questions? How are you feeling? Do you need any help? Because a lot of times they're very overwhelmed, but they don't want to bring it up, right? So ask them how they're doing. And sometimes they will tell you, yeah, things are on top of me. I'm getting overwhelmed. And when a patient or the patient's family member says something like that to you, put it in quotes. Okay, so anything they say to you should belong in quotations. So that's why I put it in quotes here. This is our proof that they're having a hard time. So what would our goal be? The caregiver will report reduced feelings of distress within 1 month. And you see, I gave a longer time frame on this one, right? This one I said by the end of the week. I don't think that it's realistic that the caregiver will be reporting less stress in just a week's time, right? So you got to think about that too. So I think if we get some things in place, maybe in a month from now, if we see them again, they can reduce their stress. So, appropriate time frames. How are we going to do that? What's our intervention? Arrange for intervals of respite care for the caregiver. So basically, let the caregiver get a break, okay? So our rationale, respite care provides time away from the care situation and can help alleviate distress. And you know, I didn't say any specific type of respite care. I could go in more detail if I had something like that arranged. So let's say the caregiver is the wife, okay? And she's overwhelmed and she has adult children who can help. So maybe setting up a schedule where the wife can take a break and the kids can take over. Or even getting like a professional, like a home health nurse or something like that. Those are lots of situations we could do. Going to an adult daycare, okay? Lots of different options for respite care. This is pretty generalized, and that's kind of the point. So to evaluate this intervention, we can say, yes, the goal was met. The caregiver reported feeling less overwhelmed, again, I put that in quotes, and happier with the caregiver role. So that was my video for an example care plan on a dementia patient. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you in the next one.